A stroke is a medical emergency that happens when the blood supply to the brain is abruptly cut off. It's a dangerous illness that could endanger your life and needs to be treated right away. It is imperative that everyone has a basic understanding of stroke, including its risk factors, symptoms, and preventive measures. We will go over the most important facts about stroke that you should be aware of in this video. What is a stroke? A cerebrovascular accident, or stroke, is a condition in which there is a reduction or blockage of blood flow to a particular area of the brain. The quick death of brain cells can result from this lack of oxygen and nutrients. Strokes primarily come in two varieties. 1. Ischemic stroke. Making up approximately 87% of all strokes, this is the most prevalent type. It happens when a plaque or blood clot obstructs a blood vessel, depriving the brain of blood flow. 2. Hemorrhagic stroke. Brain hemorrhage is the cause of this kind of stroke. It occurs when blood leaks from a weak blood vessel into the surrounding brain tissue. Risk factors. The chance of having a stroke is influenced by multiple risk factors. Among them are 1. Hypertension, high blood pressure. The single biggest risk factor for stroke is uncontrolled high blood pressure. 2. Smoking. The chemicals in tobacco smoke have the potential to harm blood vessels and raise the risk of blood clots. 3. Diabetes. Because diabetes can lead to blood vessel damage, those who have the disease are more likely to experience a stroke. 4. Poor diet and insufficient exercise. Sedentary lifestyles and diets heavy in saturated fats, cholesterol, and sodium increase the risk of obesity and other conditions. 5. Gender and age. Men are slightly more likely than women to have a stroke, and the risk rises with age. 6. Genetics and family history. You may be at a higher risk if you have close family members who have experienced strokes. Symptoms. It's critical to identify stroke symptoms in order to seek emergency medical attention. Typical symptoms include 1. Sudden weakness or numbness in the arm, leg, or face, particularly on one side. 2. Difficulty understanding, speaking, or being confused during speech. 3. A sudden difficulty with one or both eyesight. 4. Severe headache without apparent explanation. 5. Having problems with balance, coordination, dizziness, or trouble walking. To aid with recognizing stroke symptoms, keep in mind the acronym FAST. F. Sagging face. A. Weakness in the arms. S. Difficulty speaking. T. It's time to dial for help. Prevention. Although age and genetics are unchangeable risk factors for stroke, there are lifestyle changes that can dramatically lower the risk. 1. Control hypertension. It's important to regularly check and regulate blood pressure. 2. Give up smoking. Giving up smoking lowers your risk of stroke and a host of other health problems. 3. A balanced diet and regular exercise. Eating a well-balanced diet and getting regular exercise help control weight and strengthen the heart. 4. Restrict alcohol intake. Drinking too much alcohol raises the risk of stroke and contributes to hypertension. 5. Manage diabetes. People with diabetes have a lower risk of stroke if their blood sugar levels are kept under control. Stroke is a dangerous medical condition that needs to be treated right away. Preventing stroke requires knowing the risk factors, identifying symptoms, and establishing a healthy lifestyle. By being proactive and getting medical attention as soon as possible, people can lower their risk of stroke and enhance their general health and well-being. When it comes to stroke, remember that time is of the essence. If you think someone may be having a stroke, act quickly and get them emergency medical attention.